All right, guys, 1 minute to go. Please remember, the quiz will start exactly at 10 p.m. There is no negative marking, and you can answer as you like. And if you answer correctly in first, you get more points. So, all right, guys, let's get started. Welcome to JuxtaMed quiz, which is on anatomy today. So, let's get started. Here is your first question. Which of the following doesn't pass above the common tendinous ring? Your options are lacrimal nerve, frontal nerve, trochlear nerve, or nasociliary nerve. I hope you guys remember the 3 areas where we define these nerves passing. So let's see. The time is up. Let's see the answers. Nasociliary nerve does not pass above the common tendinous ring. Very good. All right, guys. So you're doing great. As I can see, every one of you has picked up a little pace. So let's keep moving forward. Your next question is, In which condition will be the greater auricular nerve or transverse cervical nerve or both thickens? So over here we're asking in which condition will be the nerve thicken? All right, that is great. Everyone has answered. Great, very well done. Very good. So let's move on to your next question. That is Brodmann's classification. So you have to match the Brodmann's areas and with their associations. Where does it lie? What is its function? Let's see if we can answer them correctly. Last few seconds to go. All right. So time is up. Let's reveal the answers. So Broca's area of 41 and 42 is associated with primary auditory area. Wernicke's is middle temporal gyrus. Superior is parietal lobule, that is sensory association. And Broca's 44 and 45 are your inferior frontal gyrus. All right. So most of you have got this right. And I'm pretty sure the rest have got it partially correct. So great going, guys. Let's keep up the pace. Moving on to your fourth question. Brachial arch and their attachments, derivators, arteries and nerve. So I hope you remember the first brachial arch, which would give what? Then second, then third, and then fourth. So let's see if we can get these right. On your right hand side, you have pouch derivator, that is auditory tube. Then you have superior laryngeal nerve, that is vagus. Then you have stapedial artery, thyroid artery, and then you have stylopharyngeus. Last few seconds to go. All right, so the time is up. Let's see the answer. All right, so remember guys, this derivative and this branch brachial arches, they have been asked like plenty means almost every time. Every time there is a question on it. So just try to remember the arteries, the nerve, and the derivative arch. All right, so what do we have here? We have Myra leading up the leaderboard. Then we have Dr. Thor Reed Stark. Then we have Krishna. Then we have Sankara, Bhagya. You never know. All right. And then Aditi, Chitana, RK, Sai, Bharat, Ramakrishna, Ram, Naga, Ashish, Thor, PP, Mary Soros. Very well done. So, and we have Dr. Thor Reed Stark with the longest stream. So that's great going. Let's keep up the pace. Moving on to your fifth question. That is, name the structure marked as 12. So let's see if we can get this one right. It's cerebellum, or is it fornix, or is it corpus callosum, or is it a pituitary gland? Very well done. Very good. Pituitary is going to be a very small gland. That is your 13. So that's not the right. All right. All right. So great going, guys. Let's keep up the pace. Moving on to your sixth question. That is, the hard palate contains What kind of epithelium does it contain? Is it a keratinized epithelium with submucosa and minor salivary glands, or is it a keratinized epithelium with no submucosa, no salivary gland, or is it a non-keratinized epithelium with submucosa, minor salivary gland, or is it non-keratinized epithelium absent submucosa and minor salivary glands? Now let's see if we can get this one right. Few seconds to go. Oh, very well done. So you're getting fast. Very good. It is keratinized epithelium submucosa and minor salivary glands. So K. I know it's a little confusing, but this is the answer. So moving on. All right, guys. Let's keep up the pace. Which of the following acts as a safety muscle of larynx? Is it posterior, trigoarachnoid, okay, good. I thought I had to read more. Very well done. It is. So great going, guys. Let's keep up the pace. Which of the following passes below the common tendinous ring? I hope it's getting you a good picture. Good. Yes, it is inferior ophthalmic vein. Very well done. So you guys are doing great. Let's keep up the pace. All muscles of larynx are supplied by recurrent laryngeal nerve, except. Okay, it is cricothyroid. C is missing, but it's okay. Guys, this is like the repeat question. Alright, so everyone has answered. That is great. Let's see. Yes. Very well done. Alright, so moving on to your 10th question. Identify this vertebrae. Now let's see if we can identify this one. What kind of a vertebrae is it? Is it L1 or T2 or typical cervical vertebrae, or is it a atypical cervical vertebrae? I think you must have seen in your Instagram or some post like that, something in your body already smiling. Last few seconds. All right, that's great. You guys have answered. Yes, it's a atypical cervical vertebrae. All right, so let's see what's happening with the leaderboard. We have PP with the longest streak, that is great. Then we have Myra leading up the leaderboard, followed by Dr. Thor Reed Star, then Keethana, then PP, then Bhagya, RK, RDT. Can you see the cutthroat competition? Then we have Sankara, Krishna, Ramakrishna. We don't want to know. Then Sai, then Bharat, then Merisaurus, Thor, Ashish, Ram, Naga, Amygdala. So great, guys. Great. It is great going. Let's keep pushing forward and keep up the pace. So your question is, a patient presented with vision loss on radiological investigation and aneurysm causing damage to the optic chiasma was noted. Which of the following arteries is most likely to be the artery that is causing the damage? Over here, the question is, which artery is causing the damage? For a patient who presented with vision loss, and you guys have answered. So let's see. Very correctly done. That is anterior commuting artery. All right. So great going, guys. Great going. Moving on to the next question. That is, which of the following is not a derivative of neural crest cells? Ciliary muscles, retinal pigment epithelium, ciliary ganglion, or melanocyte? Which of the following is not a derivative of neural crest cells? Let's see if we can get this one right. Alright, so we have people on YouTube also answering, and you guys have also answered. Great. Yes, it is retinal pigment epithelium, which is not derived from the neural crest cell. Very well done. Alright, so moving on. Now, which of the following are neural crest cell derivatives? So, which one belongs to which? Guys, remember there's no negative marking, so don't worry. Push yourself, that's it. I'm giving you a little more time, last few seconds. Guys on YouTube, you can scan the QR code and join the quiz. Let's see, what do we have here? So connective tissues and bones of the face and skull are all ganglions. Then all plexus dermis of the head and face. Then Schwann cells and satellite glial cells are dentine. And then adrenal medulla and adrenal medulla is arachnoid biomatter. Very well done, guys. Let's keep pushing, moving forward. Let's see, what do we have here in the next question? Which of the following branches of internal carotid artery are given off in the cervical region? So, could it be none of these options? Or is it keratotympanic branch? Or is it a meningeal branch? Or hypophyseal branches? Let's see. Alright guys, so the time is up. It is none of these options. Very well done. So great going, guys. What do we have here? So we have Dr. Thor Reedstrom leading with the longest streak. Then we have Myra on top and at point. Very well done. Then we have Dr. Thor Reedstrom, then Ramakrishna, PP, RK, RDT, Sai, Keethana, Bharat, Sankara, Krishna, Bhagya, Medisaurus, you never know, Thor, Ram, Ashish, Naga, and Amygdala. So great going, guys, great going. Let's keep pushing forward and with the same pace. Which of the following is not an division of the anterior thalamic nuclei? Which of the following is not a division of the anterior thalamic nuclei? Is it lateral dorsal nuclei? Is it anteroventral nucleus? Is it anteromedial nucleus? Or is it anterodorsal nucleus? Let's see if we can get this one right. Let's keep pushing forward. Think. Last few seconds. And the time is up. Yes. The lateral dorsal nuclei is the right option. Alright guys, so we're gonna keep it a little quiet for the leaderboard to reveal the main player. So the question is, during a game, a 22-year-old baseball player is hit in the head by a baseball, which fractures the optic canal. Which of the following pairs of structures is most likely to be damaged? Now we're asking you, a ball hit a baseball player in the eye, probably, right? Optic canal. So which of the following pairs is most likely to be damaged? Now find the pair which could be damaged. Is it ophthalmic vein and nerve? Is it ophthalmic artery and nerve? Or is it nerve? Or is it optic chiasma and ophthalmic vein? Alright guys, so the time is up. Let's see. Yes, it is ophthalmic artery and ophthalmic vein. Optic nerve. Sorry. Alright. Moving on to your 17th question, that is, which of the following does not pass within the common tendinous ring? Is it abducent nerve? Is it nasociliary nerve? Both divisions of oculomotor nerve? Or is it inferior ophthalmic vein? Let's see if we can get this one right. The time is up. Let's see what's the answer. Right. So inferior ophthalmic vein does not pass within the common tendinous ring. Very well done. It's great going, guys. Great going. Let's keep up the pace. Structures opening into meatus of nose. So mark the structures which open in these meatus and recess. Let's see if we can get this one right. Last 10 seconds. Alright guys, so the time is up. Let's see what do we have here. Inferior meatus is related to nasoleclamal duct. Then we have middle meatus with the frontal sinus. Then superior meatus with post-ethmoidal sinus. And sphenoethmoidal recess with sphenoethmoidal sinus. So very well done, guys. Moving on to the second last question for tonight. That is, which of the following is not an unpaired cartilage? So, thyroid, cricoid, epiglottis, or cuneiform? Which of the following is not an unpaired cartilage? Let's see. I hope you remember three. Which ones are the paired ones and which one are not paired ones? Let's see if we can get this one right. Alright guys, so the time is up. Let's see. You have got this right. Cuneiform. Very well done guys, very well done. So moving on to the last question for tonight, that is, epidural analgesia is given below which level? Is it the upper border of L1? Is it the upper border of L4? Is it lower border of L1? Or is it lower border of L3? Which one is it? Let's see if we can get this one right. Last few seconds. Alright guys, so time is up. Drum roll. What is the answer? The answer is lower border of L1. Very well done guys, very well done. So let's see, what do we have here? Alright, so congratulations Dr. Myra, you have won tonight's quiz. Very well done. And then we have Dr. Thor Reed-Stark in the second place and RDT in the third. So very well done, guys. Very well done. This is great. So this is all for you guys. You're doing good. And this is the message. I hope you guys just keep your focus only on one thing, that is getting the seat. And let's see you tomorrow. All right. Till then, hasta la vista.